Well, Dell is with us and just 2 weeks post-op. How are you?
I am amazing, Dr. Orton.
Well, I have to say that you were a trooper, a great patient, and as you saw, what did you think about seeing yourself there in surgery?
First of all, ow. I don't think you ever want to see what actually happened
I got to be honest with you, Dell. For you, we had to pull out the big chisels and the big hammer because you had some pretty heavy nasal bones there. So he's 2 weeks out. He had a splint on his nose for the first week. We like to tape them for the second week. So I'm going to remove that tape.
While you're taking off the tape, let's pull up the before picture so everyone can be reminded.
So this should gently
and
just work this off.
You did have a pretty crooked nose. And I think people forget that it's not only the cosmetic element, but functionally, when you have that deviated septum, breathing, as in your case, is very difficult. So as you're taking off this last piece of tape, I want you to look at yourself as well. Smile big into that camera. And let's do side by side.
Wow.
So now let's put this all in perspective. Only 2 weeks. He's still very, very swollen, very wide in the nasal bones. That's going to be the last part that's really, really going to come in. But you can see his tip is up because we put that little piece in there, which helps to open things up. Can you breathe in for me? That's an airway.
That's never happened in my entire life.
All right, let's do the other side.
It's a miracle.
And Drew, show us the side profile shot because that's also something that will be...
Exactly. You had what we call callus formation over your nose, and what we did was we removed that, you see, and the difference that you see in those two shots is that he got slight support elevation of his tip, and we took down that fracture, that callus that he had on his nose. So,
what does your wife think?
She loves it. I mean, I think she loves the fact that I'm not snoring next to her all night. I think that helps a lot.
And food?
Food,
can you
I can taste it. Yeah, it's a miracle. And I really, Dr. Orton.
Form follows function.
Dell,
we're good patients.
Congrats. Looking good.